Arthritis in old patients always will tell you it's like, oh, it's gonna rain tomorrow. And yeah, I grew up with my grandfather telling me that all the time, and you always think it's like, what do they know? But they actually pretty accurate. And there's actually some data behind it. Some of the ideas of why rain or cold weather, all those things change the way we feel and help us predict the weather, has to do with temperature changes in themselves. When the temperature gets colder, it may affect your nerves, it may affect your muscles. They tend to be stiffer, and as you start stiffening up, you can feel like, well, something's happening, and as a result, patients will reflect on that and think that the weather changes, which is pretty accurate. Temperatures don't just drop in 5 minutes, they slowly start trending to a lower temperature, so that our joints act as pretty good sensors per se. The rain is another character that is on its own. Springtime brings rain. With rain usually comes pressure changes. We think that when it rains, usually the pressure drops significantly, which makes your joint pressure being much higher than the outside. So a couple of things happen with higher pressure is, again, the nerves get irritated, but also increases the swelling inside your joints. So that's what barometers do. They predict pressure changes, and that's how they predict the weather. As a result, our knee or the fingers in the hand can in themselves be a little barometer that tells people like, hey, pressure changes, it's gonna change the weather, but you should act on it then. It's not just something that old patients tell you. It's something that you can take to heart, and maybe you should take some medications for it. If the weather changes, it's gonna hurt your joints. Be prepared.